excited and glad that I'm selected as a pink ambassador. The reason being is I am somebody who dreads cancer, and I really even think even my enemy should not suffer from cancer. Breast cancer is something very common in women, and that is something which can be prevented to a certain extent. And it is high time that every single citizen of India and the country should be aware of breast cancer and take every measures and possible steps to prevent it. So what do we know about breast cancer, and what we would like to be aware of is it is one of the common cancer in women after skin cancers. And who are the people particularly affected up in a female age group? Those ones who are older, number one, those with less physical activity, those ones who have not had any breastfeeding experiences. Drinking alcohol and smoking automatically puts a risk of breast cancer higher in women. So knowing these risk factors, I think we should work towards preventing these risk factors or avoiding these factors. And one of the benefits is breastfeeding will protect women from breast cancers. Why is this so important, and why are we dreading this cancer? Because this cancer appears just out of the blue, and when it appears, it almost appears in a severe condition where it is not treatable, or there is a lot more disability or morbidity around this cancer. So what should we do to avoid us to come to this kind of situation? Because this cancer doesn't come up with a pain or an obvious swelling or anything. So if one women who are above 30 years of age, definitely above 40 years of age, should do a monthly self-examination of their own breast. The best time to do your breast examination is after your periods, because your hormone levels will be lower during this time, and therefore your breast will be lighter at this time, and it is easier to assess your breast at this time. So look for lump, not necessarily just in your breast, but also look for lump under your axilla. So under your armpit, look for lump. And then assess the skin color. Is there a change in the skin color of your breast? And what happened to your nipple? Are they looking normal as usual, or is there a difference to the usual texture of your nipple or the shape or size of your nipple? Yeah. And if there's any discharge coming from your breast, becomes extremely significant when you are older age group. So constantly look at it every month, and if there's any concern, please take immediate attention to the doctors. If you're women above 30-35 years of age group, kindly keep a regular annual checkup with your gynecologist, who can advise on assessment and further investigations which are needed. So I believe breast cancer to a certain extent can be prevented, and especially if you have family members suffering from breast cancer or any other ovarian or women related cancer, it is very important you take this issue to your doctor and discuss that you are fine but your family members suffer this, and do you have any higher risk. There are genetic testing, one can do that and prophylactically protect ourselves from getting rid of breast cancer. So I think this is a great opportunity to educate the public and prevent breast cancer as much as possible, reduce the mortality and morbidity. So I would request all of you to please support Chennai Turns Pink.